Hello everyone and welcome back. So today we'll be discussing the basic difference between incised wounds and lacerated wounds. So at times it is very confusing while dealing with incised wounds and the lacerations because their shape or overall the characteristics may vary depending on the site of their location. So this is also important to note down to differentiate both the injuries. So first of all, as you must know what is an injury. So the definition of injury is given in section 44 of Indian Penal Code, that is any harm whatever illegally caused to any person in term of body, mind, reputation and property. Any kind of harm that is caused illegally to any person in term of body, mind, reputation and property. And what is hurt? Hurt is defined in section 319 of Indian Penal Code, that says that causing disease, infirmity or pain to anyone is hurt. And what is the meaning of infirmity? Infirmity means not able to perform usual functions. If some organ or any part of the body is not able to perform usual functions, so this is known as infirmity. So causing disease, infirmity or pain to anyone is known as hurt. So this is the definition of injury in section 44 of Indian Penal Code, and the definition of hurt, that is section 319 of Indian Penal Code. Now the grievous hurt are given in section 320 of IPC. There are 8 clauses as we have discussed previously. So now the basic difference between these injuries based on the type of force applied. If everyone knows that if the blunt force is there, so injuries produced by blunt force are abrasions, contusions or bruise, lacerated wounds, fractures, dislocations. So these are the injuries produced by blunt force. Similarly, the injuries produced by sharp force are the incised wounds, stab injuries, cut throats, etc. So these are the injuries which are produced by sharp force, and these are the injuries produced by blunt force. Now today's topic is to differentiate between the lacerated wound that is produced by blunt force and the incised wound that is produced by sharp force. So suppose first we'll discuss the incised wound. So as it is the injury which is produced by sharp force, sharp edged weapon or any sharp force, anything that is producing incised injury is must be sharp, and depending on that edge, suppose this is the blunt edge, this is the sharp edge, and this edge can produce the incised injury. So the initial point, the starting point will be deeper, and the ending point, suppose this is the end point, it will be shallower, and there is a tailing like this. So this is the characteristic feature of incised wounds, and it tells about the direction of force applied. So tailing is the characteristic feature of incised wounds, and it tells about the direction of force. So direction, if tailing is this side, so direction of force is to the same side. And other features of incised wounds, like as you can see in the picture, these are multiple incised wounds, multiple superficial cuts are there, and these are having sharp margins. So first is the sharp or clean cut margin. These are the injuries which are having clean cut margins. Their margins will be cleanly cut margins. And the tissue in the floor of the wound, like this, these are the tissues in the floor of the wound are cleanly cut. These tissues are cleanly cut, completely cut. and the tissues, suppose this is the incised wound that is having clean cut margins, and there are tissues in the floor. So these tissues will be cleanly cut. They will be cleanly cut. Cutting of the tissues will be clean. So because of this cutting, the cutting of these vessels, suppose vessels are crossing like this, and due to this sharp force, these vessels, end of the vessels are cleanly cut. So they continue bleeding. So these are the wounds which continue bleed, and there is more bleeding in case of incised wounds as compared to lacerated wounds because of this clean cut margins. And this is the tailing, which tells the direction. Suppose this is the starting point and this is the end point, so it is comparatively deeper, and this is the superficial part. This is known as the tailing. It tells the direction of force applied. So direction of force was towards this side, and this is very important finding and one of the characteristic feature of incised wound. Now to differentiate between the laceration and the incised, as we have just discussed कि incised wounds bleeding ज़्यादा करते हैं because of they are the floor, the vessels in the floor of the wound are cleanly cut. But what happens in case of lacerated wounds? The margins are irregular. Their margins are irregular margins, and tissues in the floor of the laceration are not cleanly cut. They are crushed. The tissues in the floor are cut. So first is regular, irregular, ragged margins of lacerations. First feature. Now the floor of the laceration, the tissues in the floor are breathing. So tissue breathing is present. In the floor of the wound. Tissue breathing will be seen. The margins will be irregular. And what happens as these are the injuries produced by blunt force impact, as we have just classified the injuries produced by blunt force as well as the injuries produced by sharp force. So these are the injuries which are produced by blunt force. So what happens? There is crushing. Suppose this is the blood vessel that is crossing across this laceration. So there is crushing. There is crushing of ends of these vessels. So this crushing leads to crushing of ends. This crushing leads to stopping of blood in the vessels. So there is less bleeding as compared to lacerations, as compared to incised wounds. These are the injuries which are having less bleeding as compared to incised wounds, because the ends of the vessels are crushed in cases of lacerated wounds and they are produced by blunt force. Now as you can see in the picture, this is the laceration which is having the irregular margin. These are the margins which are irregular margin, ragged margins, and there is tissue breathing in the floor of the wound. So this is the tissue breathing which is seen in the floor of the wound. This is one of the characteristic feature of lacerated wound. Tissue breathing will be seen. Now there are certain differences, like as you must have heard about incised looking lacerated wounds. So actually they are lacerated wounds, but they looks like incised wounds. Suppose there is a lacerated wound on the scalp area. So scalp में क्या है? There is less fat, subcutaneous fat is less fat. So because of that less fat, there is the lacerated wound looks like incised because of the margins will be slightly cleanly cut. But how to differentiate? You go for the examination or direct examination through eyes, or direct or you can use hand lens. So just check for the hair bulb. So hair bulb will be cleanly cut. The hair or the hair bulb will be cleanly cut in case of incised wounds, and they will be crushed in case of lacerated wounds. So this is the way of differentiating between incised looking lacerated wound and actual the incised wounds. So these are the wounds which can be present where the subcutaneous fat is less. But the opposite injury, that is the lacerated looking incised wounds, maybe there are actually they are incised injuries. Actually these injuries are incised wound, but they are looking like lacerated because the skin on these areas is loose. So because of this loose or lax skin, like our eyelids, underarms, scrotum, so skin or these areas is loose. So because of this loose skin, there is if there is incised wound, so because of this loose skin, the margins of these incised wounds will appear like this. These are irregular margins. So this is the characteristic feature of lacerated wound. But because of the site, because of this loose skin of these areas, the incised wounds looks like lacerated wound. So this is the basic differentiation between the lacerated wound as well as the incised wounds. So any query, please do comment, and please do subscribe Forensic Extract. And thank you so much. Keep on watching. Stay tuned.